You know, that's our jam. Welcome to Sports Doc Talk. Will Sanchez here with our residential New York Giants fan, Dr. Grant Garcia. I think he's an orthopedic surgeon and sports medicine specialist as well. But today, to kick off the 2024 NFL season, we are Giants fans in the house. Hopefully, we don't lose any of our regular fans, but I think hopefully they'll excuse it, Dr. Garcia, man. Uh, First, welcome, and then how excited you to finally have some football coming around.
So excited. I'm not I watch some sports, but my wife will say, I do a lot of other stuff, too busy in my life, but when it comes to football season, especially for the Giants, I find time. So I'm super excited. And plus, being a sports surgeon, this is where all the crazy stuff happens. You get to see crazy comebacks, which we'll talk about today. Um, you learn about all the innovative stuff. I mean, really, when you talk about the cutting edge sports medicine, it's all to get players like these NFL players back in the game. And so, it's really exciting. I love football. It's my favorite sport.
Yeah, listen, we're excited, and just to kind of let our listeners or viewers know, this is our 2024 NFL season. We're thinking about key injuries from last year coming into this year. Comeback players. Eventually, I'm going to ask you who's your comeback player of the year if you had to guess. So we'll kind of get into all of that later on. September 5th, we kick off the season. I mean, two teams, right? Possibly two MVP candidates in Patrick Mahomes and Lamar Jackson, Ravens, Chiefs, the defending Super Bowl champion. I mean, Derrick Henry is now with the Ravens. He's left the Titans. There's so many storylines, so many reasons to get excited. But for us, we're going to talk about the players getting ready for this year. But I am super excited to kick off the NFL season, especially with that doozy on Thursday night. And as always, we like to give a shout out to our sponsor, the Recovery Shop. We know it's our favorite, not even our favorite, the patient's favorite, Dr. Garcia's favorite when it comes to all the stuff that you need from the Recovery Shop. And I'll kick it over to Dr. Garcia because he uses them all the time for his patients.
It's I love this place. And again, obviously they're sponsors, so we bring them up every episode, but it's great that people can hear about this. And I was just talking to my friend in the car who works in California. He's going to plan on start using this because he's like, hey, how do I get this innovative stuff? Right. Like
Yeah.
my normal products, I can't cover, they're not covered. I can't get them into my patients. My patients want the newest stuff. And so the recovery shop allows you. And what's really cool about it too is if, we have someone on this episode and they talk about something new, I can offer it at the recovery shop for patients. So it's all built into that one section. So it's really nice for surgeons to be able to offer patients the newest stuff that may not be from the medical realm, but sort of the tech realm.
Yep.
In top of that, it's all together vetted for you. It makes it really easy, and the patients have raved. I mean, we're not going to go again on this episode about how much we love the nice machine, but the ability to offer all of those products like that, or the Rebus or something
The
else,
Reblis, yeah, that's a
in
good one.
in one place,
Yeah.
and really, I do feel like it improves the recovery for my patients. So check it out. If you're a surgeon, you can offer this too. Contact myself, the website, check out the website here at shop-recovery.net. And you'll see it on our links also. So thanks again, guys.
Yeah, and that's a great one. And before we move on from that, we started talking about this way beforehand. So check out our previous shows. We talk about the Nice Machine. We talk about the Reblis. We talk about this, these futuristic, get better, heal better, something's better for your nutrition. We've gone in depth about these machines. So now we finally have a platform that we can also make a reference to. But if you want to hear more about that, go back, check our shows. We always have great write-ups. We have transcripts. So check us out at sportsdoc.talk.com. It's a mouthful right there, as you can tell. But I'm really excited about all of that. But we're excited about this season. Before we get into that, I just have a question. I know you do work with the high school kids. Are you picking up once again working with the football team and working with the high school kids? Give us a little update for the 2024 season for Dr. Garcia this upcoming football season.
Yeah, so previously we took care of pro teams and we've had opportunities for those things, and those are fun. We've talked about them before, but
Yeah.
I have a special connection with Mercer Island High School, and that's where I currently live on Mercer Island, and I went to high school there too. So when I came back, that was I wanted to take care of the team that I used to be with my wife also went to high school there, and so
Wow.
we went.
Didn't
Yeah,
know
so
that
we
one. That's a new
basically
one.
no. Listen, I'm told you I'm going to drop a little bit each time. So we went to high school there, and I remember she was in the band, and we used to go to the games and hang out. And I had my Letterman jacket on, and now I get to be the team doc for them, and I take care of the players. Now, of course, when they come into the office, they're like, "You didn't go to Mercer Island. You're way too old." I'm like, "Dude, I'm not that old yet." And so, but it's so much fun. And so, yeah, I'm super excited. Myself, and actually, you've had Dr. Wayne Weil on here. He's also going to be helping out because he does we all basically help. Like I do most of the sports, I do the triage, and
Yep.
then foot and ankle. We had one of the coaches tear his Achilles. You know who fixed him?
Yep.
Dr. Anthony Yee,
Yeah.
and Dr. Wayne Wild when they have the hand injury. So we have a whole list of docs that can help out the team. It's really awesome, and I'm on the field with them, and I have a lot of fun, and I get to see everybody I went to high school with sometimes in the stands with their kids. So it's a super awesome experience. It's so fun to get back. So yeah, I mean, I'm so excited.
It's so amazing to think about that, right? And it's just kind of a reminder for all of us as we do our part within our communities that you leave school, you go off to college, you live a life, and then all of a sudden you're coming back 360 and back where you started, but now you're giving back to the community. You mentioned Dr. Yee, and it's one of those things when it comes to Dr. Yee. If you're seeing him and you're not there to see him as a doctor, it's great to see him. But if not, it usually means that something has gone wrong. And if we look back to September 11th, 2023, 4 plays in, as the Jets came out to kick off the season and they were taking on the Buffalo Bills, and they were at MetLife Stadium and the stadium was going crazy. It was jam packed, and they had the light show, the fireworks, and their brand new toy comes running out of the tunnel with the American flag in his right hand, leading out the cheer, and the crowd and the fans are going absolutely bonkers. And you're saying, oh my Lord, what a way to kick off the 2023 season. And for all my friends back in New York that are Jets fans, not so much my Giants fans, they are as excited as can be. Going back to maybe last time when Vinny Testaverde was with Bill Parcells and Curtis Martin saying, we have a chance. 4 plays into the season, runs out of the pocket, and Dr. Garcia, what happens next?
Achilles tear, immediately calls his buddy Dr. Elatrage, which we've heard all those things about,
Yep.
and is on the operating room table in a few days. And unfortunately, the rest is history, except for the recurrent news articles talking about Speed Bridge and how quickly he was going to get back. So, I think we'll see how the season goes. This is obviously not we've had this talk a few times. We had the Olympic talk recently. We
Yep.
had a whole separate section when he injured it. We talked about this. You've gone over your recovery too with Dr. Yee. So we've had all these discussions on Achilles, but this is now again, quarterbacks are different, right? This isn't Simone Biles having to go jump around and do backflips or front flips or her own new tricks. This is a guy that can sit in the pocket and do his throwing. He's never been known for his high level mobility. Um, but what's important, I think, for this episode, which you can bring up, and we're not going to go again, we try to talk about orthopedics, sports all the time,
Yep.
but I do want to bring up a little data because this is really interesting. Because, like, even as orthopedic surgeon, I can fire off my opinion, right? My opinion is this is not a good injury. My
Yep.
opinion he's not going to recover. And patients, that stuff they understand. I got experience. I see these things, but the data doesn't lie. And so it's really interesting to see the data because we're so used to seeing like the one or two athletes that get back. But what about the guys in the practice squad? What about the guys on the, that are not the starters? How do they get back from these injuries? Because really, they're the ones that we talked about before. Like an injured LeBron James is better than most of the players on the court,
Yep.
right? But an injured professional player is no longer a good player, right? So how long does it take them to get back, and can they get back? And this may segue into our discussion of our controversial quarterback, Daniel Jones, and his
Yep.
ACL tear. But there's two articles we'll talk about. So the first article is really easy to kind of go over, but basically it looks at return to play, so return to football in the NFL for wide receivers. Now it's not Dan Jones, a quarterback, but I looked these up because for this show, I was like, well, I want to know, because I know Will and I are going to talk about what do we think Dan Jones is going to get back? What's his performance going to be like? And I was like, well, I'm sure someone's looked at this, right? Like you want to know this data. So the wide receivers was interesting. A wide receiver, Achilles, patella, and ACL are the greatest effect on the career. And actually, they do have a decrease in success after 1 year of surgery. And what's interesting, so we always talk about the 1 year mark, but I always tell patients, remember we talked about this, Will, other than the Adrian Peterson absurdity, which we saw,
Yep.
most players are not better the first year they're back. And they're
Yep.
not at their full level. And it takes, Saquon Barkley, right? Obviously, it's kind of a dirty word now for New York. But they found that, it takes a second year and sometimes they don't get back. And of the
Yep.
four major sports, NFL players, so the hockey, football, basketball, and baseball, the NFL, the shortest careers afterwards, and the highest decrease in performance after ACL injuries. So it's just something for people to be aware of. But if you're a New York Giants fan, you'll like the second article. Second article is same guy, Burgess et al. And they found that there is no significant decrease in performance for ACL reconstruction for quarterbacks. So that is a good thing for us to hear. And maybe the mental side of things, but not for the physical. So running backs, wide receivers, we added running backs, decreased performance. But for some reason, quarterbacks do not have a decrease in performance afterwards. And it's probably because what's their main use of their bodies? It's their arms, right? I mean, they have to have
Yep.
aims, they have to have core, but they're not doing the same thing. A running back, wide receiver, you want that explosive speed. We've seen Odell Beckham Jr., 2 ACLs. They're not as good the second time, and it takes longer. And these guys are freak athletes. So
Yeah, and just to let our listeners know, these are studies going back. They reviewed it from '88 to 2017, so it's a large chunk of data that they were able to make a reference to for the numbers that Dr. Garcia just explained. Go ahead, Dr. Garcia. You're going to say something.
well, we're going to make this even more complicated because I like to do this.
Hmm.
But if you think about this, we didn't have the new ACL techniques we do. I just read an article yesterday, and Will's going to get too excited when I tell him this. So I'm going to say it quickly, and hopefully we can move on from the topic.
We're going to move on.
Adding internal brace to
Boom.
any of your ACL reconstructions for hamstring, which is they had here, probably patella tendon, which they got in quad. So all three of the grafts and these are pro players are getting grafts from their own body. Decreased tear rate, increased speed of sort of recovery, and decrease the stretching of the graft. And so, the probably one of the reasons these people don't get back as much is part of it is also, is there some natural laxity? Did they re-tear it? And those type of things. So maybe the data we might see in the next, 10 years
They're
is
going to look
actually that there
different.
isn't a decrease. So
Yeah.
we have technology. So you got to be careful. It's just like when you look at anything. I just told you all this data, but now we're not in 2017, are we? We're in 2024.
Yeah, with new technology, new concepts. Our previous show, we were talking with the gentleman from Arthrex and about how fast the technology is moving and advancing. So it's like, okay, this works, yes, but how can we make it better, right? Just so, yeah, 2024 and 2028 and 2030, we're probably looking at a whole slew of other things because as we know, and we can see in our regular, day to day, technology is moving so fast right now that the numbers are changing at an extreme rate, probably like we've never seen before.
Well, and look at the people now. I mean, we used to have, remember Tommy John, you could never throw again.
Yeah.
Now I'm talking about designing a new technique and how it's going to make people get better, and how we're going to add the internal brace, and how we're going to add different techniques, and we're developing new things so that we can do the technique faster and more efficiently, reduce revisions. If you get a first time Tommy John reconstruction, you fail it. We now have better techniques for a second one. You've heard of baseball players coming back after a second Tommy John. And so
Yeah.
that was unheard of, right? None of this is, we could do a whole show. This might be a good one, Will, later on what we do now that we like what players can come back from now they never were able to come back from. I mean, a patella tendon rupture like Victor Cruz had or other players.
Yeah.
We've had that show a long time ago. That was done. I mean, you were done. You were never coming back.
Yeah.
Now we have all this fancy gear, biologics, awesome recovery stuff. We've talked about nice machine, we talked about blood flow restriction. Uh, there are ways that we can do things now. Now, the human body is still the human body, and we have to be there, and you have to have the right surgeons, which nowadays, if you're an athlete, you can go anywhere in the world, right? Like, it's not like you got to like ride a horse and buggy to go find the next guy. Like, you hop on your private jet and you go and get fixed up by the person you think is going to do the best job.
Yeah.
So, it's a different game than it used to be, but it's pretty cool too, because as sports fans or as a surgeon that likes to watch sports as well, it's exciting to see it's terrible to see an athlete get injured and never come back, because the ones we're watching out for are the stars, right? It's really sad when you lose that level of athleticism. Obviously there's retirement from injuries and everything else, but it's pretty cool. Like, I mean, where we're going is hopefully we can see these players play longer, and play better, which is awesome.
Before we move on from Aaron Rodgers, I kind of want to bring it up, right? So there's two things I want to bring up. His injury happened week 1, September, right? Right now we have Kirk Cousins that had the same injury week 8. Now we'll find out if he's not on the pup list, and we'll kind of get into that later on. But what are your concerns as a surgeon, week 1 to week 8? So now we're talking 2 months later, right? Coming back at the same time, right? So you're starting off at the same time with week 1 in 2024. And then you're also comparing. So one of them is a time assisted, and another one is age assisted, since he's younger than Aaron Rodgers. So trying to see what's the way I want to kind of word this. If you had to pick one or the other when it comes to healing fast and being ready for the start of the season, are you more concerned about the age, or are you more concerned that one of them had recovery 2 months earlier?
So, no offense, Dr. Elatrod, he's amazing. So I'm sure his surgery was bomb proof, but I would choose the younger age to be more likely to. I'd be more motivated by the younger age. I just hate to say it, even a few years is a big difference. And
Yeah.
Aaron Rodgers looks old. Kirk Cousins still looks young. And people's bodies are different, right? Like,
Yeah.
I get into people's bodies, and I do a lot of ACLs and ligament surgeries on these patients that are between 20 to 40. And sometimes I get into a 35-year-old's knee and I say, this is not a 35-year-old. This is a 40, 45-year-old knee. And sometimes I get in and go, holy cow, this 35-year-old's got bone of a 20-year-old, right?
Yeah.
And you can kind of, you don't always tell, but you can kind of tell, that the age is a little bit is more showing on there. And so it does concern me that, and also, I don't know, maybe is there other things at play too? Are they taking weird supplements? Are they weird dieting things they're doing? I don't know all the background to that.
Yeah.
But I know that both of them probably got amazing surgeries. But if I had to choose one, even with a little bit of a difference in the timeline, I would choose Kirk Cousins.
Got you. And then, we always want to remind our listeners that, we're always talking about what we think, but without Dr. Garcia actually going into the knee, and you made a reference to that, and being there to see the ins and outs, it's never verbatim 100%, but it's kind of like the guess, because I was curious, right? Because those are two factors, right? Time versus age. I
Yeah.
know my injury later on was way different than when I've been injured earlier on. And we know that we say it all the time. Athletes are freaks, especially the way they heal and perform. And we know that Aaron Rodgers will not lose his fastball, but it will be really interesting to see a 40-year-old body start to take hits from the season. So I don't want to scare any of the Jets fans. We're going to kind of move on, because they've had enough suffering over the years.
We might get some nasty comments on our
Yeah,
podcast.
some angry
Let's move
Jets
on.
fans. And the quarterback and the team that we're rooting for is expecting probably a rough year as far as wins and losses. So we're just kind of brace ourselves for that. But Daniel Jones is coming back from his injury. Why don't you talk about that injury a little bit, and then we'll take it from there.
So he suffered an ACL tear. We've talked about ACL tear ad nauseum on this show. It's
Yep.
obviously a very hot topic. It's so common. I mean, we went through in this preparation for this player's injury list. I kind of had to say, let's not talk about any more ACLs on here, right? Because we've done
Yep.
it so many times. But it's a big topic. So I don't know what else he had done. I'm assuming just ACL. They didn't say anything else on meniscus or anything else related, but we don't know. Um, but obviously, he's out for the season. Now he's back. The question is Dan Jones. You like him or you hate him, right? There's no in between.
There isn't. Yeah.
Um, but
No.
he was known for his speed, right? He was fast. Like that's,
Yep.
I mean, give him that. He's one of the fastest. He was like he had the fifth and most in rushing, and he's one of the fastest quarterbacks in the NFL.
Yep.
And he's tall and he's big, and he's bulked up, which is nice.
He's a
But
big guy. He's a
yeah, but
big guy. Yeah. Yeah.
can he take those same hits, right? Like
Or should
he's
he?
not a pocket player.
Don't get me
He's
started
not a
now.
pocket player. No, but he's not a pocket player, right?
Yeah.
He relied the last few years, on his ability to get out of the pocket and run and
Yeah.
avoid the tackles because he had such bad offensive line, right? So it's just, I don't know. I hope he can, but there's that rust too of getting, your ACL torn, right? He's got to come back from that. But the one thing that he has dealt with is he's dealt with so much adversity and so much negative publicity and negative comments about him that I don't really know if this is going to make a difference for him. I think some of the players that have been the best themselves the whole 5 years of 10 years of their career, and then they injure their knees and they're worried they're going to be able to get back. I think there's more of a mental aspect. I just don't. I honestly think he's too tough to even be stressed about it. To be honest with you, he's put up with so much stuff, more than most quarterbacks would ever have to do in their position.
Especially in New York. One of the reasons I brought up Daniel Jones, besides the whole Jets Giants thing and everything else, but it's my concern is the neck injuries, and we talked about it briefly before we hit record on the show. He's had a few neck injuries. He's had at different times. So, I think going back to 2019, he suffered an injury, and then last year before he got hurt, he had a neck injury. And then he hurt it again. They said it was unrelated. So I am concerned, not so much from the knee aspect, and maybe you as a surgeon going, I'm concerned about the knee, but I'm also concerned about the neck injury.
Yeah.
And I'm showing here for those that are listening and not watching us on YouTube, Packers running back AJ Dillon, which is their star running back, he's on the season-ending IR. He's done for the 2024 season with a stinger injury. And stinger is always kind of like, it's always a funny thing, because I go, well, that doesn't sound like a big deal. It sounds like you got like a little pinch something or other, and you're going to be fine in a week or two. But apparently it is. Can you talk about, what kind of injury that is? And that's serious enough that without taking a snap in the 2024 season, getting hurt at a joint practice, that you are already done for the year.
So let's go through this. So first, I'll talk about the Dan Jones thing. So anytime the word is repetitive neck injury, I get worried.
Yeah.
And what the heck puts you out for a couple months? It's probably something cervical, which is his neck, and it's probably in the disc. And he could be getting some bulges, and they're concerned about it, and maybe it's pinching a nerve. I don't really know. And they were super cryptic about it. I mean, he said he had a neck injury, but he's had this repeatedly 3 or 4 times.
Yeah.
Like, that's not a neck spasm. That's something where they're worried about the health of him, and if he gets another hit, could he like get paralyzed, type of thing? In my opinion.
Oh God. Yeah.
I don't think it's that bad, but I think that there's something else going on they're not telling us, and that's okay. That's the nature of football, and the nature of the show is we get to do a little guessing.
Yeah.
With the stinger, so usually a stinger is when you get hit on one side, it's unilateral, so one side, you get hit on the side and it goes into your brachial plexus. So you imagine, I'm not going to get too much in anatomy, but imagine, you can try to show here, imagine you have your neck and all the nerves come off and they go into like your upper chest area down to the shoulder, and they branch off like this. And when you stretch them, you get your whole arm just like you feel like a sting. Like that's what I call it, a stinger.
Yeah.
Okay. And that's like, remember you guys ever hit your funny bone?
Yeah.
Imagine the whole arm.
Nope.
The whole arm is where it happens. It happens and it goes away, right? And it's usually a single, like unilateral. We say you get a unilateral stinger, you're good. Like 10 minutes, rest, make sure they're all normal, and then they go. So that's what I don't understand about this. I think that they're trying to dumb down the injury. You get a bilateral stinger, that's when you basically likely had some real bad neck injury, like like a disc in your cervical spine, which we've talked about with Dr. Schaefer before on this show.
Yeah.
And that does concern me because I don't even know if that's considered a real stinger, right? Like I think they're just doing,
Yeah.
they say like knee contusion or knee sprain or meniscus contusion because they're trying to dumb it down. And what they're trying to do is trying to play it off as not that big a deal. But the fact is, if you're out for the season with this, that is not good. So I think, I don't know what he had. I'm surprised he's not getting surgery when he goes out like that. But there are some notable neck injuries that have happened in the NFL. Obviously, the most prominent one is Peyton Manning. He had multiple neck surgeries. He had a spinal fusion, so they actually fused. We talked about disc arthroplasty or replacement with Dr. Schaefer.
Yeah.
That's where they actually, and that probably would have been, he probably would have had that now, but this was a while ago, 2011. So now the new stuff, which we talked about again, remember,
Yeah. Yeah.
if you look at all the performance of these surgeries and 10 years later, it's probably a different surgery, right?
Yeah.
So
Yeah.
he
We,
had a
we, we
neck.
had a great discussion with Dr. Andre Schaefer, and he was showing us all the cool little gadgets and, everything else that they're using in that cervical area. So, and we go back to 2011. That's a long time. We just started off the show saying things are moving fast, let alone going back to 2011. What kind of recovery would Peyton Manning, and he was getting a little bit older at that point too, but what kind of recovery would he have had? Because we know his Super Bowl season, I mean, he could barely move and barely throw the ball because he was just so jacked up.
Yeah, I mean, we talked about this a while ago, but at some point he couldn't even feel his arm. He was just throwing with no
Yeah.
triceps because one of his nerves was out. So I mean, it's just craziness. But you know what I said? LeBron James, Peyton Manning, when they're missing something, they're still really good.
Yeah.
Also helps to have a good team with you. But and then David Wilson's one of the favorite guys. Used to see him do backflips on the field, and I remember he was kind of a freak. And they talked about the next big thing. And unfortunately, after like a year or two, he had something called spinal stenosis. So it's where I'll go into basically briefly, but you basically have like your whole spine just is like really straight, and it's like not made to bend well. And if you get hit, it can be like instant paralysis. So if you have that, it's automatic retirement, which is what he had. And it actually can be happen commonly in football players. So it's a pretty scary thing. So when they diagnosed that with him, he was out.
Yep, he was a promising running back, also kick returner. We thought he was going to be another compliment along with Ahmad Bradshaw and some of the other guys that were on that Giants team. And I believe he was either first or second round draft pick, maybe out of Virginia. Anyway, at this point, I'm probably just guessing here. The
No,
same,
remember he used to do
yeah.
the best show is that remember that little intro they had to him where he was catching rabbits in the field or something crazy? They showed how he got so fast.
Yeah.
That's what we need to do, Will. You and I can do that. We should do rabbit catching. We'll get ourselves faster.
I can't catch a spider right now. I ain't going nowhere. That's it. I'm going to see how fast I can catch the remote out of somebody's hand on the couch. That's the speed that we're at right now. But
I love it.
listen, we're talking about catastrophic injuries to the running back. There was, I don't recall last year, and obviously the year before that, we had the scariness that happened in Cincinnati on the field. But as far as devastating injuries, what happened to Nick Chubb on that game, and we reached out immediately, when we were texting each other saying, "Oh my God, did you just see what happened to Nick Chubb on when he was playing against the Steelers, where that leg bent in ways that you just didn't want to see, I have a picture not of the injury because I just didn't even I saw it and I just didn't want to put it up there. But he and I want you to break this down because it said damage to the medial to the MCL, the medial capsule and meniscus, and then he had a second surgery on November 14th to repair a torn ACL. And I know some of this, and this is why I'm going to have you kind of break down this knee, what happened to the knee, what they did, and also the fact that they went back and fixed a previous ACL surgery going back to Georgia, where he had a really nasty injury. I believe it was on the sideline where his knee bent in a way that it wasn't supposed to. And when they went back in, they said, well, we're gonna fix that also and redo the entire thing, not just kind of leave it the way it was. When you hear about all of this and going in and doing, first off, multiple surgeries, It's not just one area of the knee, and how you're fixing certain things and connecting to others, and whatever peptides or God knows whatever else he's taken in order to recover. Just I don't even have a question. What's your initial thoughts when you hear about all this?
So I remember the show, and we saw the knee dislocate, right? And when you
Ugh.
told me he was going to get a small surgery, or he got a small surgery, I was like, "There's no freaking way." Right? Like, and the problem you have is, I know Dr. Vose is awesome. I think he went to same place, HSS, and then I know the other team doctor, who's a friend of mine, went to residency with me. Um, they're both great surgeons, great guys. But I think this press release was a little. The press release they talked about his knee was a little soft, and they tried not to dumb it down what he had. I mean, this is a nasty injury, and they did it in two parts. And one of the reasons they did it in two parts, which not everybody does it that way, but they did in two parts to reduce the stiffness, right? Because it's you hit. Imagine like if you repair only part of it, the knee, then it has time to calm down. They used a smaller scope, a nano scope. This is actually an Arthrex product. It's a big like thing. Is like, can we make this incision smaller? I'll be honest with you, it's a great product, but I'm not sure that this made a difference in his swelling. But I know that it's kind of a fancy thing they like to talk about, the most minimally invasive option. We can talk about this at some point.
Yeah,
And then they went back and they did, they used special screws for healing of the ACL, and somehow his PCL didn't get torn. So I think there was more to the story. But obviously this guy's a freak, right? So
yeah, yeah.
they obviously had to redo it. I think we had talked originally they did some bone tunnel grafting, because the problem you have is once you have an ACL, if it's not in the good spot or weakens out, you might need to get bone graft done, which we had talked about. Remember, you and I were talking about this because we were
Yeah.
like, how are they not bone grafting? And then all of a sudden you found out they went in there and they didn't realize how bad it was, and then they ended up doing a bone grafting or something crazy. So unfortunately, guys,
Yeah.
with this one, I don't think that the article is correct, and I think there's missing some things. It's just way too simple sounding for what we saw on the TV. It was absolutely nasty. But what's more important, I think, is if they finished the second surgery and they felt that they had a solid repair of everything and reconstruction, then I think that, hopefully a guy like that can come back, but I think his career is limited. I don't think we're going to see the same Nick Chubb, but we will see. And that's the whole point of the show, right? Get to prove me wrong.
Oh
Maybe
yeah.
there's, the newer technology they used is going to get him back, and things that we never been able to see. But I mean, I just read an article on this multiple ligament injuries. So ACL, MCL, multiple injuries actually get back the same amount as a regular ACL. Now, the problem is it's not a revision, which is a different animal, right? A second time. And
Yeah.
we all know second time for anything's not good. So, we'll see. I think my hat off to Dr. Booz. If Nick Chubb comes back and does just a similar season to what he had before, I will eat my words and I will be very impressed. So, good luck.
Yeah, I mean, listen, we don't need him to be the way he was because you were very clear. You usually don't come back to the way you were, at least initially right away. But if he could get back on the field, take a couple of hits, the leg responds well. That fear, because I'm assuming that there, I know for myself, there will be that fear factor, right? Because this was a tackle. This was Minka Fitzpatrick coming in to tackle him. He didn't want to deal with the big man, went low, right? And then the leg didn't give out, stayed right where it was, and the knee went one way, the leg went the other, and the rest is a nasty, nasty history there. So if he can get back on the field, and big picture is, yeah, you're able to walk around as you get older, right? And we're hoping that we have advances in arthritis and things like that, right? Because we always try to think about not just today but tomorrow, like all the normal folks like us, that just having some quality of life there. But it's absolutely amazing. And I remember when we were talking about this, I said, what happens if something's pinching something else and they have to go in right away? Did they put things back in place and let it calm down, or was that something that was instantaneously that they had to go in? But a perfect scenario is to let it calm down first, right? Stabilize it and then go in.
So it depends on the way it is. I mean, if it was torn artery or something, like we've seen those crazy ones in some of these. There was that one player for the Browns that had to have the artery thing done because he dislocated his knee and it was like a medical emergency, right? Like that day, or also lose his leg. I don't
Yeah.
think that's with this case, obviously.
Yeah,
They
yeah.
check all that stuff when as soon as they can. So, I mean, there is some idea to let the body calm down. This is another discussion we can have at some point. It's kind of like the idea of knee trauma, right? So, as a sports surgeon, someone comes in and they tear their knee like this, like multiple ligaments. There is some discussion. This is a debate on all these. I mean, I was just talking at one of the meetings for Arthrex, and I showed a case, and they're like, "Wow, you did all four of those things at once." And I'm like, "Yeah, my team can do it. I did it." But and some of the guys were like, "I would have done it in two parts, like they did here."
Yeah.
Right? I did one part, let it calm down, do the second part, and come back. And there is that, there's. But then you always have to talk to the patient, like, "Are you okay with two surgeries?" Right? Like Nick Chubb trusted his surgeon, and he's the professional player, and they did whatever they thought was
Yeah,
the
yeah.
best plan for him.
Yeah.
But the key is, yeah, I mean, there is some thoughts to should you do these things in parts. Um, and when you have an urgent surgery, you can do whatever you want, right? Like the person's not going to go find some other surgeon that says I'm going to do it together, right? It's not like there's a little different factor when it's something that's that you can go walk around and find different people for it. Um, but what's important to know is, yeah, I mean, their thought process here is less stiffness. So you do the first surgery sooner, fix the ligaments on the outside, not inside the knee, and then do a little check to see what everything else is gone. And then the second surgery, come back and do the inside part when it's not as stiff. And that's exactly what probably was done here. And that
Is
way you
that
avoid the
better?
stiffness.
Is that better? You would think that you work inside out, but you're saying it's better to work outside in with something. What is
Yeah,
when if you
because
decide to do two surgeries?
this is a great question. So assuming you're not grafting anything, like you don't need to do this in two parts because you're waiting for something to heal, right?
Yeah.
Like when you're grafting the bone, it means the tunnels in the ACL were not good. And if you put a new ACL, and imagine if like I put a hole out of the ground and there's a massive hole right there, right? And then you want to put like something smaller in like a stake, but it's going to wiggle around, right?
Yep.
So the only way to fix that is to fill the hole with good grass again, let it grow back, and then stick it back in. Does that make sense?
Yep.
So that would be a reason that you do two parts and you'd want to wait that's not related to stiffness. But when you want someone to not get stiff, you want their knee to get moving. Like what that we tell people is you want your pre motion to be what your post motion is. So if he's stuck, if he gets injured and they can't bend his knee past 20 degrees, then you don't want to go in there and do surgery because he'll get stuck like that.
Yeah.
But you
Yeah.
can do the outside ligaments fine, which are the MCL and the LCL, and then you can still be able to get his motion back because you're not messing with the inside of the knee. It's kind of like a bomb went off in there, and you don't want to get in there
Yeah,
and
yeah,
start
yeah.
mucking
So
about.
so he's starting rehab after the first surgery, maybe using a Rebless. Hey, shout out to our sponsor there. Here we
That
go.
would be
So,
awesome. I don't
so
know. We'll
maybe
see.
maybe
Yeah,
grabbing a Rebless and getting it the
nice
right
machine,
degree,
probably.
right? Getting some stuff going on, starting the PT as soon as possible before getting ready for the next surgery, right? And that was something that we've discussed in the past with some of our other guests, right? Starting that physical therapy prior, obviously he did not know that he was going to sustain this, so you're not rehabbing prior to the surgery. But as soon as that first surgery is done, and we're just kind of guessing here as far as what may have happened. I just kind of want to go back, and I'm trying not to get stuck here with these conversations and move on. But how do you determine the severity of the knee and knowing that you got to go in that maybe it's impinging on something? Are you sending this to the MRI to get an MRI right away to see if it's on a nerve or on something that can cause permanent damage, or what's the process, or can you tell right away? What are the steps there for you to go, oh, this is we cannot let this calm down. We have to go in ASAP.
Okay, great. So we'll change around the knowledge base there. So that's perfect. So impinging on nerves pretty uncommon with these. The one you can do when you dislocate your knees, you can stretch the nerve on the outside of your leg, and that causes a foot drop. You may have seen people occasionally that have like their foot drops and they've got to wear a brace to keep their foot up. It's called and that's the peroneal nerve on the outside. So if you dislocate your knee, that can go out. Generally, we're not going in to fix that because once it's stretched, you just want it to come back, right? It's not like usually it's cut. And unfortunately, those are a lot more permanent. Like when that happens, there's not really much we can do to save it, right? We can do grafting and everything else, but usually you give it like 10 months to a year before it see how it goes.
Oh
But
boy.
the artery is a different animal, right? The artery is the bad one. So that's the one that the guy Chicago Bears player had. Basically, that's when the knee dislocates, it comes out, and the thing in the back gets torn. It's the artery. So we don't get an MRI on those. You get a CT scan. That's a scan, a bunch of X-rays, and then
Yep.
you run dye in there called a CT angio, and you run dye down the artery. And with the CT scan, you can do it really fast. Like they can do it in like 20 minutes. And so that's what you would do on top of checking the blood pressure. It's kind of crazy. It's called ABIs. So we check the blood pressure in the foot and the blood pressure in their arm. and you tell there's a difference, right? Because if there's a tear in the artery, the blood pressure is going to be lower in the
Yeah.
foot.
Yeah. Makes
So
sense.
that's how they do it. So you check that originally, you check pulses, and then you go straight to the CT angio, and then you're in the operating room that night. If that happens with the artery,
So if the dye
everything
is
else you want to be
leaking,
cool.
right? If the dye is
Yeah,
leaking, then you know that we've got trouble, Buzz. Yeah.
yeah, and you'll just see it. I mean, look like the New York Giants. I can probably do right here. It's like goes like this, and then you just see it stop, and there's
Yeah.
nothing below it. It's just out, and that's a medical emergency, and that's when you get a vascular surgeon in there. They bypass it, and usually, unfortunately, they're probably not coming back, and you can lose your leg if you don't do that. But hopefully, we don't see many of those, and that's not what happened here. So
Have you had to experience anything close to that or something like that?
I have seen I have seen one of each. I have seen the one where it was not caught and the person lost their leg, and I have seen one where it was caught and it was fixed. So you don't want to be on the first one. That's
Yeah. Yeah.
not a good day. Unfortunately, the person was under the influence and didn't wake up for like 24 hours, and so that was a problem when they dislocated it. So that's nasty. But anyway, I don't want to gross the viewers out too much. But yes,
No,
I've
it's
had seen both.
yeah. This is what we do here.
Yeah,
That's
so if that
yeah.
happens to you and you're worried about it, get someone to see you quickly. But thankfully, it's just not that common. It's very, very rare.
Wow, that's scary stuff. But it's good to kind of understand what the process is because when you see an injury like that, you assume the worst, right? Anyone that saw that injury, any fan that saw that, you go, well, did it lost his leg? He's never going to play again. That's just when players on the field cringe, that's usually a sign for me going, oh, that's not good. Just
Yeah,
that's my sitting at home when I see the players going, oh my God, or when Lawrence Taylor is jumping up and waving over the medical staff that because of what has happened to Joe Theismann or what has happened to Alex Smith, when we see players react a certain way, whatever has happened, because these guys have seen probably the nastiest of injuries on the field. But when they react a certain way, you go, okay, that whatever's happening right now, that's not good.
yeah.
So anyway, well, the Cleveland Browns have had a rough year last year, and we probably could say that going back to probably the Bernie Kosar days. Those were probably the last good days for the Cleveland Browns fans. But their superstar quarterback, Deshaun Watson, he had a rough season last year before he got hurt in his shoulder. Multiple injuries, tough guy. In fact, he displaced this fracture that he had. I'm going to let you break it down, and kept playing throughout that game with that injury just to kind of display the toughness of these athletes. But talk about this displaced shoulder that he has, and the rumors about possible additional procedures he may have had, and the rotator cuff. He injured his rotator
Yeah.
cuff week 3 before the broken bone in the shoulders, and they, once again, James Voss and Ella Trash was a part of these decisions. So if you could talk about this injury.
So we had another. This is another one of our special episodes last summer.
Attache.
We hit all three of them. Yeah. So Dr. Elatrosh is obviously
Ella
involved in all
Trash.
of these, I think.
Yep. Yeah.
Anyhow, so
Yeah.
he broke off. Well, we don't know the full story. We actually got a couple. We didn't end up working out. We got a couple We got a couple of reporters from, I remember, the Browns that reached out to us and wanted to talk about this because after our podcast,
Yeah.
they were a little bit surprised to hear that we had some other thoughts.
Yeah. Yeah.
And that was interesting to me that people were interested that much in the topic, that the actual people that cover the Browns were asking about it. But what's really interesting to me is, we talked about this. If he broke a piece of his shoulder off, usually within a couple of weeks, it heals, right? These heals so fast because, and even if they heal in the wrong spot, they heal fast. And the fact he played through it is very impressive. Again, this is the classic example. I just don't know the whole story because it doesn't make sense to me. And I
Gotcha.
do this surgery. I mean, I do some fancy techniques to fix things like this. You want to fix these within 3 weeks, 4 weeks, or they're stuck. But I heard a rumor, and again, I don't know if it's true, is that maybe it was not fixable and something else was done actually to reconstruct the bone in the front of his shoulder, which would be absolutely insane if that was truly done in an NFL player. But, we've seen the first cartilage transplant being done. We've seen the first meniscus transplant being done in high level athletes. So I had heard that there was some possibility there was a reconstruction with something called an ankle bone or a distal tibial allograft. And again, I have no confirming data. This is what happened to his shoulder, but it just seems weird to me that when you break off the golf tee and it heals in the wrong spot, you can't re-break it and bring it back up. It's stuck
So,
there.
so,
It's
so what do you mean?
damaged.
Where is that shoulder? Is that closer to the clavicle? Like where is this for those that don't understand exactly what you're discussing? Can we get a visual of where this injury may have occurred in his shoulder?
Yeah. All right. Let me do my best. So the black box is the golf tee, and that's the socket, right? So
Okay,
the
I got you.
socket's like this.
I got you. I got you.
So
Okay.
imagine if I took off 25% of this and broke this off.
No, that's
Now
not
when I
good.
do this, it slips out,
Yeah.
right? It slips out faster. But when you break a piece of plastic like this, if you maybe right away you can glue it, but maybe after a couple of weeks it heals the wrong spot. You can't get that piece up again. It's done. Like if it's there, you're not going to re-break it and shift it up. It's just not going to happen. What you have to do is replace it with something else. And so I had heard potentially that he had something replaced there, but that was never told on the information of that. And if he got
So
something
his
replaced,
injured
that's
rotator cuff had played a part in maybe, something,
I think the
compounding?
rotator cuff tore when he dislocated his shoulder because like now generally it only happens in people over 40. So if you're over 40, you dislocate your shoulder, you have a very high chance of tearing the rotator cuff. And I've fixed patients like that before
Or a
that have torn the
350-pound
rotator.
man landing on you, on your shoulder? Would that
That is a new indicator. That might be a new reason to have it. Yes. If a 350-pound man lands on you, then you're more
okay,
likely to tear your rotator cuff.
okay,
But
okay, just
so
a second.
so again, more to the story is here. Like the good news is that these patients, if it's stabilized, actually do really well. I mean, it sounds like a nasty injury, but like if you can stabilize his shoulder, I actually think he'll get back pretty well. Like I'm not as worried about Deshaun Watson as I'm about the other ones we've talked about. Now we'll see. Again, it's my prediction. He
Yeah,
may
yeah.
do poorly, and the Browns are screwed. But I think that whatever he had done is probably going to keep him stable. And if Elatrosh was doing anything, he'll work his magic. And I think we're going to see another miraculous recovery from Dr. Elatrosh's surgery skills.
So they determined the injury will require immediate surgical repair to avoid further structural damage. You made a reference that if it sits around for a few weeks, you could have that permanently damaged. Is there anything that kind of, has the light bulb go off in your head where you're like, this was an immediate surgery that they had to perform once they kind of found out what was going on, that they determined the head physician along with Dr. Elatrosh?
Well, so I mean, as soon as you see that glenoid fracture, I mean, I have one of these coming up, and then you're just like, oh, that's not a good thing, right? Like once the bone's broken on the shoulder socket and he feels like his shoulder shifting out of place, he'll just destroy his shoulder. He won't be able to throw. So that's why they wanted to fix it, right? Because like
Gotcha.
in a normal human doing normal activities, they can't tolerate this, right? It's slipping out. He's obviously not a normal human. He's super athletic, but he's also putting his shoulder at high. I mean, having to throw the ball and throw at the velocities of the accuracy he does, and already having a not perfect socket or base for the arm is not a good thing. And so, you could see that I think this was actually more of a surgery to help longevity rather than just for the acute situation. Does that make
Mm,
sense? Like they
yeah.
could have, like if he could, like if they wanted, they were probably worried he's going to do more damage, and they just put a lot of money in their investment. This was to save their investment.
Yeah, I mean, you think about the torque, you think about the speed, the accuracy, you think about people landing on it. He is a mobile quarterback. He does run around. It'll be interesting to see if they had that conversation with the coaches saying, "Hey, you've got to find a way to coach him out of this a little bit." Some of the things that we like to see Daniel Jones maybe do a little bit less. So it all around. I don't have the player's name. I know they've looked into their backup quarterbacks, making sure that their backup quarterbacks are kind of legit and ready to go as well. If without knowing everything that's happening, if everything goes smoothly, what's the timeline here? For having this was week 10, so 2.5 months, October, November. I guess right before December. I'm guessing. I'm not looking at the calendar, just thinking about the timeline, or close to December, that he suffered this injury. We're now kicking off the NFL season the first week of September. Is that timeline concerning for someone that works on shoulders and things like that? And for your thought process, or you're like, well, once that's done, they've done X, Y, Z, they've done the rehab. It's just a matter of going out there, getting contact, and seeing how it holds.
So what's crazy is with the shoulder stuff, minus the baseball players, and maybe quarterback might be a little different. Generally, we're talking about 5 months. I mean, I've had linebackers with these injuries come back in 4.5 months. So it's crazy if done well, as long as the bone heals, if they had to do a bone healing procedure or whatever, you're talking about 5.5 months and you're letting them rip. So it's different than a knee. So I think he'll be back. Like I said, I mean, I wouldn't wish any of these injuries on anybody, but I think if he had if again, I don't know what happened. This glenoid fracture thing is still super crazy to me that it was injured weeks before and they found it and then they had to do it urgent surgery. So I have no idea exactly what they found, but I can suspect what they did. But
Yeah.
based off whatever they did, I'm assuming that they feel pretty good about it, and I'm assuming that he, hopefully will get back.
AFC North has been getting taking their lumps. Obviously, one of the MVP candidate, one of these guys probably going to win the MVPs between, Joe Burrow and Lamar and Patrick Mahomes. But once again, Burrow ending his season, torn ligament, wrist. I mean, he had a real rough season where he had an earlier injury to start off the year with a calf injury, and then he had this torn ligament. Any concern with the wrist area for Joe Burrow going into this season? Besides, he hasn't played much football, the last year, as far as taking hits, spinning the ball, gripping the ball, right? I mean, I think gripping is one of the concerns. And I think if we had Dr. Whale here, we'd be talking about that. What are your thoughts on that?
Yeah, I mean, I'm worried about it. I with ligament stuff like this, where you're not doing a reconstruction, you're just basically repairing it. I think if he doesn't get anything stuck, I think he'll actually be pretty good. I
Oh,
think it's
okay.
more but that's just me. Again, I'm not a hand surgeon, so I do less of these.
Yeah,
But
yeah.
I tend to be less stressed about something like this. I'm more worried about the knee stuff and the damage and the revision situations. Unfortunately, the knees take the longest. This is a good one though, so we'll move on. This is a good one
Yeah,
because this
yeah.
is like a
Anthony Richardson. Yep.
controversial thing.
Yeah, Anthony Richardson. I wanted to get to that because we've been yip yapping away, and as time is ticking over here, let's get to Anthony Richardson's with his AC joint sprain. And once again, we hear sprain, or I hear sprain, I go, well, that doesn't sound like it's too concerning. But grade 3, what's your biggest concern with this? Also, once again, it's the throwing arm.
Yes, so this is controversial topic. Good, you picked a good job. You always do a good job with this, Will. So AC joint injury, acromia clavicular. So acromion is this. It's a shoulder separation, right? You've heard the word shoulder separation.
Yep.
It's really common in bikers, football, direct blow on the shoulder. The thing about this is, for every grade, there's 6 grades, but we almost never see the 4s and the 6s. Those are like with some weird, the cloud was stuck underneath. It's just almost, I've almost never, I think I've seen one in my whole life. Um, but
Wow.
the 3s and the 5s are the ones you worry about because those are the ones that might need surgery. 1, 2 is like a little bit, 3 is where it comes up a little bit more, and then 5 is where it's like way up. If he had a 5, he would have automatically gotten surgery. Okay.
Yep.
But because he's a 3, the 3 is where it's on the fence. And so the data shows that if you have a 3, that half those patients don't need any surgery, they'll get back on their own. And I have one of the Mershon football players I just did this with, and I was able to treat him without surgery. But some people come back, and I've had this at like 2 months, 3 months, 4 months, and they still feel bad. They can't throw, they have like popping, and it's unstable. And what they've seen now is it's actually maybe more like a 3A and a 3B. The A's can get back, and the B's don't, because there's actually a component that's, we think about AC joint injuries, the chromium goes up, right? That's how we measure it, but we don't think about it. Remember, our body doesn't work in one plane; it works in 2 planes. So the concern is that some of these grade 3s actually have this stability and this, and when you have both, then you might not get back. My assumption is he just had this one, right? Or they would have probably done surgery on him. But
Yep.
we've done studies on this looking at baseball players. It's a really common baseball injury. And you ask about the team doctors, and it was crazy because only half of them said they would ever do surgery on this. The other half said never would do surgery on a grade 3. I will do surgery on somebody, but again, the studies show that you want to try no surgery first. So the surgery timeline, the recovery timeline for this is about 1 to 2 weeks for every grade. It's like an MCL. So about
Without
6
surgery.
weeks without
Without.
surgery. So 6 weeks.
So you should have the needed information for you to think about your next step within the 2-week period.
Usually I tell them 6 to 8 weeks, Now with him, he's going to get you monitored more closely. But like I told the football player in the office who's going back and play, I said, go back and play for the season if you can. And if it starts feeling unstable, you can't do it. We got to pull you out. We're going to do surgery on you. And if you can tolerate it and it's bad at the end of the season, then we do it at the end. So what he may do is but again, you can see these bikers, they come in because we have all this biking around Mercer Island and around the area. The bikers have both of them. They look like little horns, right? They got AC joint injuries on both sides and they've done no surgery on it.
Wow.
So it's really depends on the patient and how they feel. But it's that shucking anterior posterior, so front backwards. And that's why we're starting to see these like that the grading system we have may be too old school, right? Like it doesn't give us, because the reason we make grades, and I know we're almost over, we make grading systems so we can determine, we can say, okay, that grade 2s need this something, this grade 3s needs this something. Does that make sense? That's why we grade these things. So we can describe them more easily, right? So like we know grade 1 takes this long, grade 2, we can just like, by having that documentation, it makes it faster. It's a conversion chart for surgeons and for all of us.
You think it's time to
United
reassess these grades for these type of injuries? Possibly without starting trouble?
I think, well, no, we're talking about it where you're going to start some trouble. I love it. No. You're absolutely right. And there are people looking at it. There was a paper about this recently that wanted to regrade some of these because we don't have a good system. And this grade 3, like the number of ones that grade 3s come to my office, and I go, listen, you might need surgery, you might not. The only ones I benefit from are the ones that come in at like 2 or 3 months, they have a grade 3 and they're not happy, because those are the ones I know need surgery, right? Like they've already declared themselves. But these acute ones, a lot of times you don't need surgery, but it's tough because they get different opinions and some people say you need it. So this is one of those ones that's a gray box. This is a great topic.
Any concerns for him this season as we get ready to wrap up? I could talk about this for another 2 hours. Anyway, go ahead.
I know you could. You open up Pandora's box every time you ask me about an injury. The concerns for him are, I hope he doesn't have the B. I hope he got the A. I'm assuming he does. He wouldn't have got surgery already, probably.
So we might.
The nice thing about these
we'll
injuries, they don't damage the inside of the joint.
All right. So once he starts playing football, gets hit, we're going to find out if something needs to be done. So there is a question mark about his 2024 season. Until we see what happens, right? Is that comfortable enough to say there?
Yeah, I have a good feeling about it. I feel like they would have pulled the trigger already.
Got you.
I have a good feeling about it. So,
all right, we had a bunch of other stuff to talk about, but we're not. We're going to end on some trivia to kick off the season. All right, 3 players have won the NFL Comeback Player of the Year award and a Super Bowl. Can you name one of those 3 players?
J.J. Watt?
Nope. One more.
Tom Brady?
Tom Brady is one of 3 players. He won the Comeback Player of the Year in 2009 and then won the Super Bowl that same year. Peyton Manning won it in 2012 and then won the Super Bowl. And Rob Gronkowski also was a part of that. So hip, hip, hooray. I'm excited about the year. I got my Tiki Barber jersey on. Can't see it there. Tiki Barber. I know you got your Giants. I'm really excited.
I got to put my Brandon Jacob.
Yeah. And, hey, we're going to update our listeners throughout the year. We think it's important, these injuries and top players. So be in the lookout. We're going to do some short, quick hitters. I hope we'll keep it short, but probably not. And keep all of our fans ready to go for this season, man. I appreciate you, Dr. Garcia. It's always good to chat with you, and we look forward to our upcoming shows. Check us out at sportsdoctalk.com, where we have plenty of content and transcripts. Say goodbye, Dr. Garcia. Bye-bye.
Thank you, guys.